Good evening, and I know I'm coming on late. It is Sunday night. I was here working, getting ready for next week. I noticed on my news feed that I tend to get, that there's a report of Jamie Foxx's condition. Now, this report came from the giant freaking robot. They report some news through TMZ. The headlines, and I'll share this with you, states that Jamie Foxx remains hospitalized and it's not sounding good. I want to make a few comments on some of my previous posts on this topic. Many of you who have been following us on this station have made comments regarding the reports. I initially came out and talked about early reports of Jamie Foxx possibly having a stroke. Excuse me, at that time, those were the early reports. What I want to clarify, respond to some of the comments made, is that one, I don't have any inside information. I don't communicate with the medical team with Jamie Foxx. And I just want to let you know that we're not violating any HIPAA rules. That's number one. Number two, I want to share with you that the major emphasis for sharing this type of content with the audience is to not only talk about what might be going on with Jamie Foxx, any other star, but to have a broader conversation. What I want to do is educate the community about how you can potentially protect yourself from any cardiovascular event, whether it's a stroke or heart attack or the like. You may be aware that I talked about a number of other famous athletes, entertainers who suffered from significant cardiac conditions, some who may have died, some who have survived it. Tony Braxton is one example. She underwent bypass surgery and she reported her condition. And we talked about heart disease and lupus. What I want to do is talk to you tonight about the whole issue of young people dying. As you all know, Jamie Foxx is very young, 55 years old. I consider that to be very young. He looked very fit, very active, and took care of himself. So why, would he or someone like him suffer this type of event? And he's not by himself. There are a number of other athletes who've died young, a number of other individuals. So my topic today is, why are young people dying? And I want to share some clinical insights and, more importantly, share some solutions. As usually, I'll have my uh, um, PowerPoint, and I want to first of all talk about many of the leading cause of death. And this is a CDC report from 2021. And the leading cause of death, number one was heart disease, number two is cancer. Now, first and foremost, these are always the two leading causes of death. I've done talks about this on my show. Heart disease and cancer every year causes almost as many or more deaths than all the soldiers that we've lost in every war in the United States. Number three in 2021 was COVID-19. Those deaths have dropped. I'm sure 2022 deaths, COVID-19 will probably not be in the top three. Then you have accident, stroke, chronic lower respiratory disease. Now, if you add stroke as part of cardiovascular disease, because most causes of stroke are cardiovascular related, then cardiovascular deaths are even higher than this. And then lower respiratory diseases, that's things like pneumonias, chronic obstructive lung disease, Alzheimer's disease, diabetes, and the like. So chronic illnesses lead the top cause, and this is across all age groups. Now, what I'd like to draw your attention to, and many of you in the comments talk about certain treatments for the recent pandemic and certain potential side effects. I'm not going to get into that in this talk. There'll be other times where I'll talk about that specifically. But in terms of looking at the potential effects of the recent pandemic, you have to think about the effects of the spike protein. So whether you're talking about the coronavirus infection itself, you're dealing with the issue of the spike protein, or certain treatments for the coronavirus itself, you're dealing with the spike protein. So one thing I want to make you aware of, many people are not aware of this, the spike protein, however it gets in your bloodstream, can have effects on your lungs. It's called pulmonary effects. It can have effects on your heart or cardiovascular system. I've seen lots of people, you're aware of pericarditis, I've seen lots of people with heart attacks, individuals with arrhythmias, elevated blood pressure that's poorly controlled, gastrointestinal effects. There have been scientists have shown that your microbiome is disrupted by the spike protein. There are neurological effects, musculoskeletal effects, people with increased arthritis. We're seeing that in our clinic. And reproductive effects, stillbirth, infertility's gone up, and of course, hematologic effects. These are effects that can be caused by the spike protein itself. And I won't get into any theories tonight regarding why um, the spike protein does that. There are articles on that, and we'll talk about the mechanisms. Shaquille Oatmeal says 55 is not young. Okay. 55 is younger than 80, and it's not old. Queen Jet Black. So we're having an argument in the chat as what old and young is. I'm 59, so 55 is young to me. We'll have a vote later on. But the point is, there are lots of organ systems that can be affected by the spike protein. So what's the real issue? The real issue isn't so much the infection or the treatment for the infection, etc. The real issue is what condition is your body in, and that's always important. If you catch a common cold can kill you if your body is in poor condition. So I like to have my patients, and when I talk to my patients, I like to have them focus on the condition of their health, not the condition of whatever the therapy may be or whatever the looming illness might be. So, what are some of the issues in terms of your health? Tonight, I want to focus on the immune system and oxidative stress as it relates to the immune system. Now, this is a busy slide. Now, I've given this talk before, and some of these slides may be familiar to many of you. It's a busy slide. I'm going to briefly talk about biochemical balance, but there's this condition known as reactive oxygen species. This is generated by lots of things: poor sleep, excess exercise, consuming junk food and toxins, excess alcohol, and there are antioxidants that counteract these reactive oxygen species. And these things that help prevent free radicals from damaging the cell. So essentially, what free radicals do, or reactive oxygen species, they're unstable molecules. You can think of them as chemical reactive molecules or radioactive molecules. And they're unstable. They move around inside your biological system. They damage DNA, they damage cell system. So when you consume toxic substances, when you consume too much alcohol, too much processed sugar, too much animal protein that's fried or barbecued, or excess oils, you're consuming reactive oxygen species or free radicals. And when you put these things in your system, then it creates an unstable environment. And this process over time weakens your biological system. It weakens your cardiovascular system. It weakens your kidney function. It has adverse effects on your pulmonary system, your kidneys, as well as your liver. And it also weakens your immune system. And the immune system is what's critical in this situation, because an immune system that's impaired can be impaired to one of two different ways. You can have an immune system that's suppressed. A suppressed immune system will not protect you from other infections. A suppressed immune system will not protect you from cancer. And a suppressed immune system will not protect you from uh, uh, other types of illnesses that can impair your overall health. But you can also have an overreactive immune system. So an overreactive immune system is revved up, and that's the type of immune system that will attack you. It attacks your organ system, attacks your heart, it attacks your lungs, it attacks your musculoskeletal system. And I'm going to talk about how that happens over time. But how do you get an immune system that's in poor balance, poor nutrition? This is bad food that you're eating. If you add an infection, whether it's the spike protein or some treatment for the spike protein, these work in synergy to cause an imbalance. You have an excess amount of reactive oxygen species that puts you in what's called oxidative stress. And when you're oxidative stress, that means your immune system is revved up in a way where it can start to attack you. That's when you get this condition known as long COVID, when the immune system is constantly revved up and it starts to cause damage to the native tissue, native organs. And here's a complex slide that talks about things that feed into it: sedentary lifestyle, restricted diet, lots of these things that go into it. So you think about what happened during the pandemic. Many people were, you know, sitting around the house, who were not exercising, were eating bad food, and they were getting infected. So you had the situation, if I go back to this previous slide, you're sitting around the house eating bad food, then you get infected, then you create a system where you have increased oxidative stress, and you have a situation where you compromise the immune function. This compromised immune system can last for a long period of time. So a compromised immune system then starts to worsen cardiovascular disease. It can cause blood vessels to become damaged, therefore your blood pressure is poorly controlled. It can cause inflammation of the heart muscle, therefore you get pericarditis or myocarditis. It can cause damage to neurological symptoms. People get neurological conditions such as Guillain-Barré syndrome or neuropathic conditions. They can have nerve pain, musculoskeletal. Have many patients come in with increased arthritis and the like. So you're having a situation where an impaired immune system, which is compromised, it's revved up, and you have this persistent autoimmune condition. This can happen with any infection. Many of you may have heard of the condition of strep throat. People can have long-term sequelae of strep throat. I've seen individuals with long-term sequelae of any type of viral infection. So it's not just coronavirus. So the key is to have a healthy immune system. And so, what are the steps toward improving the health of your immune system? Well, they have to be the same thing. It's the same steps that improve your overall health. Antioxidants for the immune system starts with substances that work against free radicals: vitamin A, vitamin C, vitamin E, selenium, zinc. Zinc also has antiviral properties. Glutathione is a super antioxidant. It also recycles vitamin C and other antioxidants. So these are the micronutrients that are very powerful toward enhancing the immune system. Now, this is a busy slide, but I cannot get away without talking to you about food, because plant-based nutrition. Now, I'm not going to go through the details, but hopefully you can come back and look at this source of vitamin A, source of vitamin C and E. There are many great food sources, and you should be consuming these foods on a regular basis. Um, so, my recommendation to my patients, I treat lots of patients who are at risk for COVID disease, at risk for other chronic illnesses. Consume plant-based diet. Consume a lot of raw fruits and vegetables. You should do, 7 to 10 detoxes, 10-day detoxes yearly throughout the year, maybe 3 or 4 times a year. You should have an increased variety of foods in your diet. You may need supplements. You need to get quality supplements. Speak to your physician or functional medicine doctor and get advice in terms of the quality supplements. There are many over-the-counter supplements that are not very good. The supplements are formulations that we use in my practice, or specially made for us, and are tested multiple times. Here's some other micronutrients that are very important for your health: copper, folate, iron, selenium, zinc, and different vitamins, as I've mentioned before. Now, some people who have advanced illnesses may benefit from advanced integrative and regenerative therapies. In our practice, we utilize things such as intravenous ozone therapy and high dose intravenous vitamin C. We use intravenous methylene blue, external cardiocyst treatment to improve cardiac performance, infrared sauna therapy. So sometimes your condition may be so advanced, you may need some advanced therapies that can be very beneficial for people with advanced heart disease and the like. So remember, your body can heal itself if you just simply provide it with the right tools. And I can't overemphasize the importance of optimizing your nutrition. Plant-based foods, hydration, fresh air, sunshine, exercise, all of these things are important. These things are important to boost your immune system. When I say boost your immune system, you want to optimize the immune system so that, one, it's strong enough to protect you, and two, it's not overreactive such that it attacks you. That's important. However, these same approaches, these same lifestyle techniques and nutritional approaches that are beneficial toward for protecting your immune system, enhancing immune system, guess what? They're also beneficial for improving your overall health. So if you have heart disease and you practice these things, guess what? You start to reverse your heart disease. If you have diabetes, you practice these things, guess what? You start to reverse your diabetes. And similarly with arthritis. And we see this all the time with these patients. So I just wanted to be encouraging to you. I want all of us to lift Jamie Foxx and his family up in our prayers. Our thoughts will be with him. But I want us to also keep in mind that, despite the fact that we're hearing all of this dreary news about, young stars who are getting ill and dying, we need to learn from these situations and take advantage of this and improve our health. This is a time for all of us to stand up and improve our health. Don't rely on someone writing a prescription or someone, admitting you to the hospital or doing some procedure. You have the power to improve your health, to enhance your overall immune system, to avoid many of these ailments. So I want to leave you with that. I wish all of you well, and thank you very much for supporting the channel. If you like what we had to say, again, hit the thumbs up button. Give us a positive impression. Subscribe if you haven't done so. We would like to welcome you to the channel. And of course, please share this message with anyone and everyone you think who can benefit from this. This message needs to go viral because we need to take a stand for our health today. Until next time, y'all have a good evening and God bless you.